Congress is 5, so by adding 2 is 15 mils. We have total volume is 15 mils. Concentrations 500 mg.
Okay, I've got patient Miriam Adib who's for PCA for post-fracture ribs. Okay, good morning Miriam. I'm Ori, your nurse for today. I can see from your notes here that you're experiencing some pain from your fractured ribs. So what I'll do is I'll prepare some PCA morphine for you to hopefully help you control that pain. But before I do that, I just need to double check your identity. Can you please state me your full name?
Miriam Adib,
Your date of birth, please?
7169.
And MRI numbers 174963, 174963. Do you have any allergies?
No.
Okay, so also I need to double check what your level of pain score is. So 0 for being no pain at all to 10 being extremely painful. Can you please let me know how painful you are at the moment?
9.
Okay, so I will be giving you that morphine then. Also, I'll just double check your cannula side to make sure it's okay for me to process that medication. So is there any pain when I press here?
No.
Okay, so I know that the cannula site was put in less than 72 hours ago, so it's okay for me to also administer medication there. There's no signs of inflammation or redness. Okay, so I'll leave you with the buzzer for the meantime. So if you do have any questions or if you do need assistance, you have a buzzer to press. So I'll come back and just gather the equipment. And second nurse, do you mind validating the order with me?
Yeah.
So I've got patient Miriam Adib, date of birth 7th of the 1st, 1969, MRN's 174963. She's got nil known allergies. This is an IV narcotic analgesia chart. It's going to be given for her post-fractured ribs. So the order is for morphine 50 milligrams and 50 mils. It's been signed by the doctor with the name printed. The date is within 7 days, so it's still valid for me to use it. The criteria has been listed as well. So concentration is 1 milligram per mil. Number of syringes is 3. PCA dose is 1 milligram. The lockout interval is 5 minutes. Basal infusion is 0 milligrams per hour. The hourly dose limit, however, is just 12 milligrams, and it's been signed by the doctor. I've got also an antiemetic given just in case any side effects does occur. So the drug is for metoclopramide, given 3 times a day. The dose is 10 milligrams, given through an IV as well. It's been signed with a date listed. Naloxone is also going to be given for respiratory depression. So the drug is naloxone. The route is going to be 0.2 milligrams through an IV as well. The intervals is 2 to 3 minutes. It's been signed by the doctor with a date listed as well. So this medication of the morphine through PCA is due now, but it hasn't been given yet. Do you agree? I'm just gonna have a look at what morphine is on a drug injectable handbook. So from here it says that it is an opioid analgesic. I can give it through an IV, and it was ordered through an IV route, so I know that it's okay for me to do it through that way. It's compatible also with sodium chloride, and I know that I need to mix it up with sodium chloride as well. On the MIMS, it states that some adverse reaction can be circulatory depression, hypotension, GI upset, and sweating. I know that the dosage, I don't exceed the dosage for morphine, which is 20 milligrams. So I know that it's okay for me to give it to the patient as well. Okay, so I've looked at the MIMS and the drug injectable handbook. I'm just going to rub my hands, and I'll calculate how much I'll need to specifically give to Miriam and also gather my equipment. Here's my medication calculation. So from here, I know that the vials needed is 5 vials of morphine. The volume of medication is 5 mils of morphine, and the volume of diluent, which is normal saline, I'll be drawing up 45 mils to make up the total of 50 mils.
All right.
Yep, I'll just gather my equipment now. Okay, so I'll be needing morphine for today for Miriam Adib. So I've got morphine now, and the last balance was 10, so there should be 10 in here. Okay. So I know from my calculations that I needed to get 5 vials of the morphine. So 1, 2, 3, 4, 5. Okay, I'll just do my check. So I've got morphine 10 milligrams in 1 ml, which is morphine 10 milligrams in 1 ml. Expiration date is 10/20/20. Morphine sulfate injection 10 milligrams in 1 ml. Expiration 10/20/20, and morphine as well 10 milligrams in 1 ml. Expiration October 2020, and morphine 10 milligrams in 1 ml. Expiration is 10/20/20, and the last vial morphine and 10 milligrams in 1 ml. Expiration is 10/20/20. And this is what I'm taking, and this is what I have left, which is morphine, 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 and morphine, all this with the same expiration date. So when I complete this form, and I know there's just 5 left. This is what I'm returning. Prescriber is Dr. Hunt. And second nurse. Okay. This. I'll just do my first drug check with you now. So my patient for today is Miriam Added, date of birth 7th of the 1st, 1969, MRS 174,963. She's got nil known allergies, and I checked this with the patient when I did the patient check with her. The order is for morphine, 50 milligrams and 50 mils, and based on my calculations, I needed to get 5 vials of morphine to make it up. And so I've got morphine sulfate 10 milligrams in 1 ml, 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 and the last vial, morphine sulfate 10 milligrams in 1 ml, all with the same expiration date of October 2020. And also, I know the doctor has also written down a criteria for PCA. So the concentration is 1 milligram in 1 ml. The number of syringes needed is 3. PCA dose is 1. The lockout interval is 5 minutes. There's no basal infusion, but there is a 12 milligram hourly dose limit. It's been signed by the doctor, and the doctor's name has been printed, and with a date within 7 days, and also an antiemetic of metoclopramide and naloxone has been given. It's due now and hasn't been given yet. Do you agree? Hi Miriam, I've gathered all the equipment, but before I can prepare and give you the medication, I just need to ensure that I do your vital signs. So I'll be doing that so I can get a base reading of your vital signs. And I'll come back also and in a few minutes, so I'll just prepare the medication now.
Okay, Miriam, I have to check your vital signs also.
Is the packaging of the syringe still intact? And same as with the drawing up needle. And since I know that I need to give a total of 50 mils to the patient, I've got normal saline here. So second nurse, can you please check the normal saline with me? So I've got sodium chloride in 10 mils, 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 all with the same expiration date of September 2018, September 2018, I've got 5. But I know that I only need to make up 45 mils of it because the other additional 5 would be of the morphine. I'll just add the 5 mils of medication. Okay, and second nurse, can you please check if this is 50 mils?
Yep.
Okay, and 50 mils. Okay. Just do my label. Now, so I'll just complete my fluid additive label to attach to the medication. So I'll just write down the name. Medicine is morphine. 50 milligrams. 50 mils is 1 milligram. Mil. Diluent is normal saline. The date, so it's the date of when I did the video, which is the 18th of March. The time was at 1:45. And second nurse, can you please sign this with me? Thank you. So I'll attach this to the medication. So my fluid additive label is all done. Okay, and I'll just do my second drug check now. Okay, do you mind checking if this is 50 mils for me, second nurse? Okay, and I'll do my second drug check now as well. So my patient is Miriam Added, date of birth 7th of the 1st, 1969, MRN's 174963. She's got known allergies. The order is for morphine, and I've got morphine in this, and I've got morphine here as well that I'll check. So I know from my calculations I need to get 5 mils, and I've got morphine sulfate 10 milligrams in 1 mil. Expiration date is October 2020. Morphine sulfate expiration date 2020 of 10 milligrams in 1 mil. Morphine sulfate 10 milligrams in 1 mil, expiration 10/2020. Morphine sulfate 10 milligrams in 1 mil, expiration 10/2020. And the last one of morphine sulfate 10 milligrams in 1, expiration 10/20. And I drew up also 45 mils of normal saline to make up the 50 mils in total. And I've got sodium chloride here, which is September 2018. Sodium chloride here, expiration September 2018. Sodium chloride, September 2018. Each vial contains 10 mils as well, so September 2018 and September 2018 for sodium chloride. And also the PCA criteria, it's been listed the concentration is 1 milligram per 1 mil. There's three number of syringes needed, and the PCA dose is 1 milligram. Lock interval is 5 minutes. Basal infusion is 0 milligrams in an hour. Hourly dose for 12 milligrams has been signed by the doctor. Also, the doctor's name has been printed and it's within 7 days. An antiemetic of metoclopramide has been also given, and in naloxone. It's due now, hasn't been given yet. I'll just prime the line now. So prior to this, I would have sanitized my hands already. Okay, so my lines are all primed. So my lines are all primed. I just need to connect this now to the PCA machine. And second nurse, can you please be with me when I connect it? So for my notes, so I can see here that this is already set for morphine, so I'll keep it as is. Drug is morphine, and from here I know that's morphine needed here. Drug concentration is 1, so I've got 1 milligram per 1 mil, so I'll keep it as is. PCA dose is 1, so I'll keep it as is as well. Lockout period, we've got 5 minutes here and we've got 5 minutes here, which is correct. Occlusion level, I keep it as 8. Continuous, yes, so this is not continuous, so it's going to be kept at 0. Loading dose is 0. Maximum limit, I can only give 12 milligrams as noted here per mil, so I need to change this one to 12. So I've done it. Okay, limit duration, I keep it as is, so I know when to come back for the patient. PCA delivers that, then okay. Okay, so I know from here all of the criteria I've got here is what's correct from the medication chart, so I can start it now. And then okay. Okay, and this is that. Change it to remove. Okay, and as shown, this is my criteria. Okay, and I'll connect this to the patient now. Hi, Marianne. I've set up the PCA machine, but before I can do that, I just need to double check your identity again, make sure that everything is okay before I give it to you. Can you please state me your full name again?
Miriam Added.
Your date of birth, please.
7169.
Yep, and MRS 174963, 174963. Do you have any allergies, Miriam?
No.
Okay, not a problem. And also, I'll just do my final drug check with my nurse, and then I'll attach that all for you. Second nurse, can you do the final drug check with me? So I've got patient Miriam Added, date of birth 7th of the 1st, 1969. MRN's 174963. She's got known allergies, and I know this information is correct when I did the patient check with her. The medication for today is morphine, 50 milligrams and 50 mils, and I know that I needed to get 5 mils of morphine, and I've got 5 mils of morphine here. So morphine, 10 milligrams in 1 mil each, so there's 5 vials, which makes about 5 mils. And this has already been included in the actual syringe with the 45 mils to make up the total 50 mils of medication. So it's 45 mils of normal saline that I added, and it's all, I've already done the criteria as well on the PCA machine. And so the PCA concentration is 1 milligram. The number of syringes is 3. PCA dose is 1 milligram per mil. Lockout interval is 5 minutes, which is written here. Basal infusion is 0. Hourly dose limit is, you've got 12 milligrams, and it's been signed by the doctor. Okay. Okay, Miriam, so I've set up your PCA machine. What I'll do is I'll just give you the morphine now, so you can get that relief of your pain. What I'm doing is I'm just putting on my gloves. Okay, and I'll alcohol wipe the side first. And I'll leave this dry for 15 seconds. And once it's dried up, now, which is now, I'll connect the medication.
Where is it? When did it stop?
And I'll put tape around the side as well so it doesn't fall off or it doesn't cause you any uncomfortability as well. Okay, so Miriam, the medication's now attached to you. What I'll do is I'll explain how to use it as well. I'll turn it on first and remove the key. Okay, and I'll explain how to use this. So you will have this button to press. So once you see that the bottom flashes a solid green, that means you can press it for another dose of medication or pain relief. If you do see it flashing green, that means that it indicates that the medication is going through. Now, there's a lockout period of around 5 minutes, so it'll let you know when you can press it or not. Do you want to have a try? So at the moment it is solid green. Okay, so now it's blinking, so that means the medication is going through. I'll come back in 15 minutes or so to do another baseline of ops, so we can monitor how you're going as well, just in case any side effects do occur. We do have medication that can help you. So if you do have any dizziness or headaches, just please let me know. So I'll leave you with the nurse's buzzer as well. So just give that a press if you do need any other assistance. All right. Discard my equipment. Okay, so what I'll do is I'll just make sure that everything is signed and documented as well. So the date that I put it up is when I prepared the medication, which is on the 18th of March. That's when I did the video also. The time up was around 2 o'clock. I'll just write my initials. And second nurse, can you please sign this with me as well? Okay. So my documentation's all done. I know that every time I do obs, I can list everything here. So when I come back in 15 minutes, I'll be writing all of the observations here also when I come back for my patient.